We're here today with Dr. Chris Cobourne, who's a bariatric surgeon. Dr. Cobourne, exactly what is lap band surgery?
Lap band surgery is a simple outpatient procedure where a small inflatable band is put around the very upper part of the stomach. What this does is create an area of narrowing, allowing patients to feel full after eating a much smaller amount of food.
What's the difference between lap band surgery and gastric bypass surgery?
Gastric bypass surgery is a procedure where, although there is a restrictive component, for the most part it works because the bowel is shortened. Patients or individuals will eat and the nutrients will pass through their system without being absorbed, and that's the mode of weight loss. With the lap band procedure, the weight loss is achieved completely through restriction of intake, so patients just eat less food.
So you're making the stomach smaller through a band, putting a band around the stomach, and then they lose their appetite, or their appetite is lessened? Is that how it works?
They just feel full with a much smaller amount of food. We can adjust the band, allowing us to modulate their weight loss over time, which is another advantage over gastric bypass.
When you adjust the band, is it another surgical procedure?
No, I'll show you if you like. This is the lap band device. So if we imagine that we've put that on the very upper part of the stomach.
This is my stomach now.
Yeah. So if we've created a small channel there for the food to flow through into the distal or the end of the stomach, if we think that food is going across too quickly, we can access this little port device, which has been placed surgically just under the skin, and we can tighten or loosen the band and adjust the rate at which food flows across the band into the rest of the stomach and the bowel.
So if you feel like you're eating too much still, or it's not quite working the way you want to, you can adjust it easily.
Absolutely. In fact, the adjustments are the critical part of the whole process. It's very important that patients come back and have their band adjusted regularly to achieve the sustained and permanent weight loss that we look for.
Is it uncomfortable for the patient?
They really don't feel much at all. If they eat too quickly or don't chew their food well enough, they will feel uncomfortable in their stomach. So they learn to just modify the way they eat more than anything else.
They're not feeling a tightening every moment of the day in their stomach area?
No, there's really no sensation until they eat.
Until they eat, and then they just feel full.
Correct.
Now, who's a good candidate for this surgery? Can this just be you're 20 pounds overweight and you go in and get lap band surgery so you know you're slim forever?
Our clinic has criteria that we operate on people based on their body mass index or BMI. Generally, patients with a BMI greater than 35, those classified as being morbidly obese. Turns out to, depending on a person's height, that might be anywhere between 80 and 100 pounds or more overweight.
Would you recommend it for 50 pounds or somewhere on the edge?
Generally not. It depends on one's height again, but 50 pounds is a little bit less than what we would normally do.
So this is good for somebody who's been battling the bulge, so to speak, and they're quite a bit overweight. And this is a permanent operation. Is it a permanent placement?
The band is meant to stay in forever. If we take the band out, patients will go back to eating the way they ate before the band, and the weight will be regained.
That's interesting. Thank you very much.
Do